it keeps us up at night. I mean, that's the first thing you check because when we know what's going on and they know what's going on because we're packing. Well, let's just pack just in case something happens while we're waiting for you your number not to be called. So we got to get prepared. It's like hurricane. You got to get prepared for the hurricane. We're hoping the hurricane doesn't come. We're preparing for the hurricane. But while we're doing that, we're putting out calls to people that can make and help. So we're just hoping that, and it doesn't mean the Medicare plate. We're calling churches, hotels. We're making sure at the end of the day, when the 0:30 hour comes, like it happens all the time, because if they stay on the property is liable. So they're giving all their medication, they're giving all their clothes, and it's like checkout time is at 11, and it's unless the governor calls and says we gave you a stay, you got to go. And so it's where do you go? Because the service that you had 24 hours ago, as in transportation, as in a guaranteed hot meals, a place to bring yourself back to after you've done all that you've done to the day. That's no more in play.
So you guys have done this already with
Time and
folks.
time again.
Time and time again. What's a so even before like these legislative changes like really start to kick in, like what was like a reason that like people would just be like you're off, like you've been cut off?
Because they know that they've either run the paperwork and things haven't matched up to how the facility will want it. And it's not the facility, it's the rules. You know what I'm saying? Either the pay's not going or they don't get enough money anymore since the funding has been cut. So it's a bunch of reasons that things like that go on. And when you're 89, 90 years old and you're sitting there and you gotta leave, none of those reasons really make sense when you've literally majority of your life paid into this plan. You've worked all your life. You've raised a family all your life. For whatever circumstances this is, you're here. Now, we've come to work, and the bus stop literally has had like 3 residents in there with their clothes, with their stuff in there, and their medication. And so we're making calls, hey, you're off today. Can you see if we can come get somebody? Can your church get somebody to come up here and get such and such? And they're literally in a bus stop.
I want to back up for a second.
Dogs
Like,
gonna have a pound to go to. The puppies, they'll pick a puppy up to take a puppy to a pound, a shelter.
but there is nothing like that.
There's nothing like that for people.
Yeah. I want to back up for a second, just so I can have like a better understanding of like how a situation like that like comes to me. So like in the example of like someone who's like 89, 90, right? I would assume that like and this is where my ignorance is. So like please help me out here. I would assume that like all things working correctly, like that person is like on Medicaid. So like what changes with like a person like that where they're cut off from situations like
Funding cuts,
oh,
laws,
like Medicaid funding.
yes, laws are cut.
Yeah.
Whatever their diagnosis is, they might not cover that anymore.
Okay.
It's a lot of things that play into this that have nothing to do with the people.
I see. That's infuriating.
Mhm.
So a couple of years ago, really like my introduction to the wonderful world of Medicaid, was
That's grand over here.
it's grand. It's grand. I started reading up and started really becoming more familiar with it right when Medicaid redetermination was like announced, and when they started terminating people post the public health emergency, COVID,
Yeah.
right? Was that a thing that affected residents?
Oh, totally.
Yeah?
Yeah. Not only that, a lot of them passed because it's a certain criteria in the nursing home. They don't want to move them to the hospitals, but if you're talking about COVID, but of course it was so packed anyway. But they're supposed to be able to take care of this stuff in house. So a lot of that, and a lot of them are too fragile to move. So that was another game changer, when all that stuff happened. So when we were having that go on, after that, that's when, like you said, everything changed too. That's when a lot of the rules change. That's when they start going back and privatizing and revamping and doing all the things to supposedly not have a crisis like this where people were going to be cut out from the bottom. And I don't know if we're not the people, but we were cut out from the bottom, and all the safety nets didn't apply anymore. They got tighter. They got more strict with the how you qualify for things. So pre-existing conditions, sometimes aged out. You know, when you used to be on people's insurance, you weren't allowed to do that anymore. And so everybody's just like walking around in the fog. It's horrible, but literally in the middle of the night, overnight, and during the pandemic, I woke up and it was a different world.
When I was reporting on the, what did they call it? They called it not redetermination, unwinding, Medicaid unwinding.
Yeah. That's so clever.
Right.
Wow.
When I was reporting on that, when they finished, right, the year-long unwinding process,
Yes.
It turned out about like 51% of Floridians who got terminated from coverage, 51% of them lost it, but they still qualified, and they lost it for what they called procedural reasons, or like red tape reasons, right, where like DCF couldn't like make contact with them when they were. Oh, is that what that is?
I just feel dumb.
Is that what that is?
Look, see, when you hang up with me.
Oh, that's so cool. I thought there was a train. I figured it was a train.
You're so cute.
No, that's so
You gotta
funny.
come to the bill more often.
Oh my
Okay, now be serious. Get yourself together now. Listen.
Professional.
You fanned out right quick, didn't you? Listen.
I'm a dog. You say treat. I'm like, where? Yeah, so
The unwinding.
Unwinding. 51% lost it for red tape reasons, they said. And these were like, you know, the phone got disconnected, or like they couldn't make contact via computer, or like the resident didn't know how to like use the computer, right? So from what I've been hearing from like experts who are like, you know, taking a look at all of this, they're worried that like a repeat of Medicaid unwinding could kind of happen with this, where you know, they do figure out how they're gonna monitor work requirements, for example, right? But, and to couple with what you were saying earlier about like all the letters that these people get, all the paperwork that they get, there's, I guess, a concern about things not being properly communicated. Is that something? It sounds like that is something that you probably saw during Medicaid unwinding or Medicaid redetermination.
Right.
Is that right?
Absolutely, and that's deja vu how you said it, because literally, it's whoever thinks of his names. I think they put more into that than they really have a clue about the people part of it. But that's literally what it is. I mean, you know, you have to have an 80-year-old woman. You have to speak to her directly. But then she's got to show her ID or her birth certificate to say that she is who she is, or he is who he is. How many of them have that floating around? You know, really, if you really think about how many have their original documents. So wherever those are, if you don't have those, then okay, call us back when you get something else. And so we have to speak to Miss Sarah. Miss Sarah's sitting here on hold for 3 hours, 4 hours. It's just a thing. And just think of all the people that's going, thousands and thousands of people. Sometimes you just give up and just be like, I'll just throw myself on a mercy because I don't know what to do. I've literally sat in this office all day till it gets to the same time. Oh, well, literally I've heard recordings where they cut off and say, we're not taking any more people for today or whatever, when they've literally sat there all day, or we sat there, we taking turns, you know, taking turns. Sarah, you go eat, you go sleep, we'll have the thing on. It's a maze, or it's something, you know, whack-a-mole, because if you stick your head out, you're getting popped. But then what else are you supposed to do but take that chance? Because it's your life. You have to have these services. Or just tell us what the end game is. We're cutting off everybody, and everybody just get out here and get you a bow and arrow and a fishing pole. You know, just say something real, because it was a time when people looked not only to their families, but the United States government to take care of these things. What? Not for free. Not because you weren't supposed to be here, because this was what you did all your life. You worked into these programs, you paid into these programs, you believed in these programs, and you believed that when you got to a certain age and you were able to withdraw from these things, that it would be something there. That's what is the whole thing for in the beginning. And then you're just sitting there with no answer. They don't have anything anymore. So if they don't have anything for this population, what's next? If it's absolutely gone now for the people who poured into it all these years, do you really think behind this curtain of Oz we're in, there's anything? What could there possibly be if they're telling the people who built this thing all this time, we don't have anything for you? What makes us think? And that's the fear too. We see it all day long. What's going to happen? And I'm sitting in the seat. Are these seats going to even be available? What is about to happen? Because it's looking like these organizations are going to be no more.
Well, when you say organizations, which organizations? You mean like Medicaid, Medicare?
Yes. Yes. They're bankrupt. And so, from whatever, they say they're bankrupt. So, the people that are coming up now, the generations that are coming up now, what? And not even that, my generation, I'm next. So, what is there? There's nothing there.
That's really scary to think about.
Yeah, you have to put it to where it really is. And you're looking at these people every day and I'm up next. And they have nothing. So what would possibly make you think?
Talk to me about, we were, or earlier, I referenced Medicare Advantage, some changes that we were seeing this month. Could you just walk us through real quick what those changes are and how they're affecting folks?
Oh my gosh. The most immediate change, like I said, the program is getting cut. The funding, there's no funding. So when there's no funding, there's no for specialty, for heart doctors, for for diabetes, for things like that. You just have to be healthy because all these pre-existing conditions are wiped out. All these things that have always been covered in the normal, they're not covered anymore because they don't meet the criteria that the government has said that it is what we're covering. So I don't understand unless it's just hair transplants and what I'm saying. I don't know nothing normal that we know normal is being covered anymore.
Have there been residents over at Titusville Rehab? Titusville Rehab? Am I remember that right? Mm-hmm. Cool. Titusville Rehab that have received letters saying that hey, at the end of this month.
That's a constant letter, and they just call it the letter. Have you gotten your letter? The residents know? You know what I'm saying? They know when, pretty much, because they know when they used to get evaluated. Yeah. Now, if you're cutting out the social workers, they used to come to give you this information. That's another thing. Their workers are getting cut, or we don't cover that anymore. So you basically have a person in-house that's trying to do all these people. You might have an organization that had people that came and checked on you or whatever. They're not. Those organizations are closed now. They don't have those parts of the healthcare system anymore. So when you're just sitting there and you haven't had a visit for a year, you pretty much know it's going down. And they just call, have you gotten your letter yet? Do you know when? And that's when a lot of families are panicking and trying to get paperwork and documentation and things like that, because normally these people are not, they're not wards of the state. They're basically their own person. So you got to go get custody of mama, get all her stuff, where you can be contacted. That's dignity issues, You're being reduced to, I don't know what the word is for that, because you don't have any say-so over your health care anymore. You don't have any say-so over your right to basic necessities. Those are human rights. Those are human things you've always had. So it's a lot of depression. It's a lot of thoughts of, I'm not seeing so many elderly people talk about suicide or ending their lives, or they wish other things would happen, or, if I'm going here, if I could get a way to make it where I could get enough medication, I do this because I'm a burden on my family, I'm a burden on my community. I've never heard older Americans talk like that.
Why do you think that is?
hopelessness. You've seen how it plays out. You've seen the people, your roommates up on the bus stop. You've seen people, and you've seen people that take care of you just crying and just knowing it's like a death every day. Because if you've had these people in your lives and there's literally no service. There's no service. They go to hotels where other things can happen to them. They can get preyed on by whatever god awful situation will be out there waiting. They could get robbed for medication. And we're talking about older people that trust people. Such says that, if I have access to my check every month, she'll make sure I can keep a room here. So you take your $250 or $300 or whatever you get, and it's gone.
I want to take a moment to also ask about affordable health care. Obviously, that's a big change that we're seeing this year. At least it looks that way.
Right.
Are those changes? Do those stand to affect residents over at Titusville Rehab, or is it a different population?
It affects them because, like I said, the age is different. It affects them so much, all of them, because who even knows the laws that they pass today are going to be the laws that they enforce, or the laws that are going to be in 5 months. We're talking about maybe tonight a government shutdown, and they're sending everybody home. So what in the world? You never know. You never know. And then they're passing things in the middle of the night.
Yeah, it's just it's completely in flux, right?
Period. Yeah.
The state of healthcare, especially right now.
It's totally up in the air for the termination on that day. And by the end of that day, things could change. It's like the weather here in Florida.
I really liked your metaphor earlier about hurricane preparation.
Yeah.
It really does feel like that. I think the thing I always hear is like the silver tsunami, right? Which is unrelated but sort of related to what we're talking about. But as far as like healthcare and like having some pretty detrimental effects on people who might see it stripped away, I think that's the perfect comparison that you're making. Kimberly, as far as the residents go, you just described a couple minutes ago about a sense of hopelessness for some. What keeps you hopeful? You're a very optimistic person, it seems like. Or you have joy. You carry joy.
Absolutely. Attitude of gratitude. That's what I have.
Attitude of gratitude.
Attitude of gratitude. That is exactly what I have. Because being raised by my mom and my grandmother, that was an everyday mission. That was a mandate in my family that you help somebody every day. Every day you help somebody. And like I told you before, my granny was Odessa, and they don't make those anymore. And she just always believed in people. I mean, she always put herself out there, worked 47 years without missing a day. And she was a business owner, a woman business owner in a time when that was, very, very rare, a black business owner at that time, being a woman. And I mean, just through Chattanooga, she made her name that, I've gotten into many doors by just saying I was a granddaughter.
Yeah.
So I don't know any different. And then meeting the people that I meet and these things that I do, getting in, $11.99. Your tribe is always there. And now it's like people are seeking out people. And it's not even the same Republican or Democrat. I'm seeing that. Because it's finally getting down to, hey, we can eat. You got potatoes. I got some charcoal over here. That's what it's getting down to. So I've met so many people that don't even have the same political views that I have, but they know that something's on fire. And you just can't keep hanging curtains in the living room and they're burning the house down in the back. It just doesn't work. So I don't know the other way. So I just have to keep moving forward. Keep doing what I know what to do. That's gonna make a difference every day. I don't know anything else to do. And just take the privilege that I have in being able to take care for these people and being in service of these people and just humanity. And I really just believe in that.
I love that. And I also, I got to take note of the fact that you mentioned you're grateful for the privilege that you have while you are wearing a shirt that says privileged.
Yes, I am. I definitely am. And it doesn't really, I've been stopped about that a lot, with things that are going on. And sometimes you have to take words back because society and information highway, they want to try to change words to divide people. And when you just say, no, we're not doing that, you have to stand up, and that gives you a conversation to have with a person maybe that doesn't even think like you, in the bank, wherever, in the store, in the Goodwill, in Walmart. You've been shopping with me in Walmart, and it's always a conversation. And as long as we're going to able to always have the conversation and don't have to have necessarily be passionate, but the anger doesn't have to be there. And so, yeah, I'm really privileged. I really am.
I think that's all I've got for you regarding healthcare. Is there anything I didn't ask you that you want to make mention of?
I just appreciate you coming and taking the time to talk to me, and because I am a CNA, and we're most of the time, they don't really, because if they ask us, we could solve the world, you know what I'm saying? One day in Congress, you know what I'm saying? We could have everything solved, but the people that are really grinding the gears, we don't get a chance to even have a voice. So I just really appreciate you taking the time to even reach out and understand that, we're here.
We met when we said, oh man, when did we meet?